the American Society on Aging, and I want to welcome you to a special edition of ASA Live that we're airing from our second to last day of our On Aging 2021 conference. To those attending, thank you so much for being here and for really taking advantage of all the rich content and networking opportunities that we've provided this past week and a half or so. I'm joined today on our ASA Live by Dr. David Rue, who is from Microsoft. David, welcome to the show.
Hi, Peter. Thank you. It's a real pleasure to be here.
Have you been enjoying the conference, your session?
It's been fantastic. Thank you so much.
So I want to get us started and get right into our topic today, which is about how public and private partners can really drive change in creating greater health equity. But first, for our ASA members who aren't familiar with you, Dr. Rue, can you give us a little bit of your background and how you sort of ended up at Microsoft?
Yeah, well, I'm a physician. I'm a healthcare technologist, but I'm also a health services researcher that's been very interested in understanding why there are disparities of care. How can we better address them? In fact, some of the earliest studies that I implemented when I was in my training were around how to improve vaccination rates for individuals in long-term care facilities. Looked at ways that we could implement nurse standing protocols to be able to implement, make things more efficient. And throughout that, I guess my career, I've always had a curiosity in terms of like, why is it that we're seeing this? And then also, what can we do to best address this? Now, one of the things that we did find is that if you gave right information at the right time, it would have an impact on clinical decision making. And if you streamlined workflows, you could certainly make things more efficient. But the problem was using a lot of the tools that we had available back in the day, which were basically humans running around telling people, or maybe posters and flyers. We really didn't have the vehicle to do this at scale. Now with technology, it's a different story. We have technology with us every day. It's either part of an existing health system that you use every day, or maybe it's your phone. And that type of vehicle allows us to be able to provide a new form of clinical decision support that gives us information that can be relevant for how we better treat patients. And so much of my journey has been around applying technology towards improving those outcomes, specifically looking at vulnerable populations and those that are in highest risk. And at Microsoft, I serve as the Global Chief Medical Officer, where we look at this from a very global perspective, looking at ways that we can address issues that countries face and that healthcare organizations face, but with the ultimate goal of making lives better for the individual.
So one topic that's front and center here at the conference is creating greater health equity. So let's turn to that. It's probably not immediately apparent to our ASA members sort of why and how Microsoft is working on health equity. So I'm hoping you could provide Microsoft's perspective on the matter.
Yeah, absolutely. One of the things we did early on in the pandemic was that we started identifying that there were many issues that hospitals and health systems and governments were facing relative to addressing this pandemic. And what we wanted to do was we wanted to see if technology could help address many of them. In fact, implementing things such as a COVID chatbot or it's an AI-based chatbot that was designed using the CDC COVID criteria, we could answer questions at scale and triage patients. And certainly this started on the path of increasing use of telemedicine and telehealth. And then we started moving towards vaccinations. And vaccinations has been an extraordinary, complicated and problematic area, because it's not just about vaccinating as many people as quickly as possible, but it's also about making sure that the highest risk, the most vulnerable, are not left behind. Now, the unfortunate thing is that we're starting to see that, especially now that as we're opening up criteria, we're finding that what was difficult before for some of the higher risk, more vulnerable, the seniors, those with disabilities, they are actually now going to be even less likely to get the vaccine. And so what we've now been implementing are strategies that we can apply the technologies in a more direct route, working through partners that have long-standing trusted relationships with these individuals that allow us to be able to provide a path towards higher vaccination rates.
Well, I'm glad you bring up the topic of vaccinations. You mentioned the number of people being vaccinated in this country is almost, exponentially growing every day. But there are, a number of older adults, particularly those who have faced discrimination their entire lives, including older adults of color, LGBTQ plus older adults, people with disabilities, like you mentioned. They do face the greatest risk of in the pandemic and significant barriers to accessing the vaccine. Can you dig a little deeper, perhaps, and give us an example of a partnership that Microsoft is engaging with right now, or some examples of partners that Microsoft would be looking for in the future on how to best deliver vaccines to those most vulnerable populations?
I think a really good example would be some of the work that we started with Los Angeles Unified School District. LAUSD is the second largest public health school district in the country. And we started out with a strategy on how to bring the kids back to class. And then that quickly evolved into testing and allowing us to be able to put a testing strategy for not just the kids, but the family members. And then now with vaccinations, we realized that to get the teachers back in, we're going to have to vaccinate the teachers, soon the kids, but also in the process, we started looking at how do we extend that to families and communities. And it turns out that kids don't live in bubbles. They live within a family, that within a larger community. And if we're going to try to address these issues around bringing kids back to school, you need to start looking at how do we implement these programs more widely. Now, what was interesting is in LAUSD has some areas that are well-to-do and others are not as well-to-do. In fact, the ones that we find where they're not as well-to-do, the inner cities, the lower income areas, that in those areas, we oftentimes see multi-generational homes. So by focusing on the families, the kids were sort of the entry point. It then moved to the families, and then it brought us to the seniors and to the other individuals within the home. That was a very interesting path, because we learned that our approach to how we engage and bring individuals who may either be unaware or reluctant to bring the vaccine sometimes comes through the most trusted sources. And so the first would be family, and so if the family is on board, they'll bring the parents or the loved ones over. Now, the second was that we've been talking with healthcare organizations, and clearly healthcare organizations have that trusted relationship, but we also realized that they are also missing a good number of individuals, and it's the not-for-profits that may end up being one of the areas that we need to tap into. So this ties into this bigger, broader concept of a public-private partnership, whereby perhaps the not-for-profits, and one of the not-for-profits that we've been talking to most recently and actively on this is Easter Seals. And so in talking to Easter Seals, the largest not-for-profit organization in the United States, also addressing seniors, those with disabilities, veterans, they have locations throughout the entire country. They have these programs that directly interface and interact with the individuals. And in some cases, not just about communicating, it's actually about making sure that person has a ride to get there. And that's the level of relationship that we're looking to leverage, because those are the people who not only can convince them, but then can also enable them.
That's a really great example of a partner. Easter Seals and other similar national organizations, as well as local organizations, are ASA members. So to the ASA members, how would you encourage, what are you looking for, whether it's Microsoft, or how would you encourage ASA members to be in a strong position to partner with companies like Microsoft who are looking to do this kind of work?
So we really see the vaccination as a starting point for how we can bring the level of engagement and services to those that are underserved, including seniors, those with disabilities, underserved areas. Because what will likely happen is once you've invested the time to build the vaccination components, we can then leverage that for testing. And then we can add things such as providing food services. We can then do health screenings, and we can do eventually healthcare. And that's the opportunity where we can start thinking about how this could be a model that we could potentially scale across the country. So my call to action would be, if there are organizations that are interested in this type of model, we are actively right now trying to prove that this is a model that is sustainable. In fact, the work that we're doing at LAUSD is in fact a very beginning of something that we're just describing, because these schools are serving as community health hubs. There's testing, there's vaccinations, there's food being delivered, and it's all being done through a trusted partner. And so those are the core ingredients. We think that healthcare can be delivered through these organizations or through these sites to the people that are most vulnerable. And we are looking for individuals and groups to be able to start doing this, grassroots efforts all around the country. Microsoft is here to help support. We have an ability to stand up vaccination clinics literally on the dime. We've been doing this in Seattle, for instance. What we did in Seattle was we have within the Seattle area, they're using Microsoft facilities. The local healthcare providers, Evergreen and Overlake Hospital, are providing the vaccinations. And then we stood up the system that allows them to be able to do the scheduling, the registrations, and the ongoing reporting. And so it's a great partnership, with healthcare providers and technology organizations and not-for-profits that we're trying to establish. Probably different flavors across different parts of the U.S. And that's the reason why one size isn't going to fit all. We're going to really need people to look into this and not only implement it, but study it and understand what works well and what doesn't work well.
Well, as you know, the ASA is very interested in helping you out in any way, shape, or form. And I know many of its members will also be interested in helping. One area, though, that we haven't touched upon that I'd like to get your thoughts on is, we talked a little bit about businesses and nonprofits collaborating, but there's sort of an very important third leg of the stool here, which is government. What do you think at the federal level should be done or is happening that is actually helpful in reducing whether it's inequities in access to vaccinations, or even more generally, if you have views on, reforming long-term care or expanding access to home and community-based services?
You're absolutely right. We can do through heroic efforts, philanthropic efforts, a bit of productive efforts to improve vaccination rates. But there's a lot of investment of time and resources for one goal. What we'd like to do is we'd like to be able to create a sustainable model where you invest once upfront for this infrastructure, and then you can reap the benefits of all the things that go beyond vaccinations. I talked about health screenings and essentially building a bridge to the folks who need it care the most. And that's going to require federal investment into this as a program. Now, we've been in active discussions with several members that within the government agencies that are focused on this area. They recognize that there needs to be more than what we're currently doing specifically for vaccinations. But I'll tell you where their limitations are. So if you think about retail clinics as being an ability to provide access, well, it turns out that retail clinics are not evenly distributed, even in cities. So some cities may have more than others. And then in certain areas, like in Los Angeles, you'll see a higher density of your retail clinics in maybe the higher income and less in the lower. So even like when we looked at LAUSD, we saw a 25-2 ratio of schools versus the retail clinics. So schools actually are far more accessible to the individuals than the retail clinics. And so I think we need to start realizing that that's an aspect. And then, there's been a federal allocation of funds for community health centers, which is fantastic. It's the right approach. But we also have to take a closer look, because actually in LAUSD, it was many of these community centers or the FEMA centers that were reaching out to LAUSD because they were saying that in order for us to, we just weren't getting enough volume. People weren't coming in. And part of it was because they didn't have that long-standing relationship. Many of the people that come into the facilities, they were there as more of like an urgent care. Something happened and you came in, but But what you really want is an organization that has a long-standing relationship with that individual. Because in that scenario, what you're doing is you're tapping into the trust. And then the trust allows you to be able to then move forward and be able to do all the things that may be more a complicated, difficult conversation. Without that trust, you can't provide healthcare to those that need it the most.
Well, I couldn't agree with you more. And I know many of our ASA members share that view, and often will talk to their partners in the community and invite them into their programs and services because they do have that fundamental trust with the older adults that they serve. Listen, Dr. David Ruth, thank you so much for joining us on ASA Live. It's amazing what Microsoft is doing in this space, and we're very grateful for your innovation in really helping close the gap with respect to vaccines. But I suspect this is going to evolve into something bigger. So thank you so much for joining us.
It's been my pleasure. Thank you very much.
Thank you. And to everyone watching, thank you so much for joining us on ASA Live. Tomorrow is our last day of the On Aging conference. We hope you join us for the closing sessions. Thank you all.